Hello everyone. In this particular video we shall consider the next concept under the principles of toxicology, that is the general management of poisoning. So far we have considered what exactly a poison is, or what a toxic substance is, or what a toxicant is, what is toxicity. We have seen the classification of toxicity, the different agents which cause different types of toxicity. Again, we have considered the mechanism of toxicity also. Now let us consider the next concept, that is management of toxicity, or management of poisoning. In case of poisoning takes place, in case of excessive exposure or exposure to a particular toxicant, what exactly are the measures which you are supposed to take to tackle that particular situation? Because in certain poisoning, even the life of a particular person may also be endangered. This you can come across several drug treatment also. Normally the patient consumes several types of drugs for treatment of a particular condition, so over there also sometimes poisoning may take place. So what are those different ways by which you can manage this particular poisoning, how you can control that, or how you can even prevent further exposure, or what are the measures you can take to tackle this particular situation? So already we have seen what a poison or what a toxicant is, how it can be harmful to the body. Now let us come to the first measure which is supposed to be taken for the management of poisoning, that is resuscitation and maintenance of vital functions. So this is the first aspects which you should look into when a poisoning has taken place. Secondly, the identification of the poison, that is also very important. If you know what exactly is the substance which is causing the poisoning or the toxicity, it becomes very easy for you to consider what treatment is supposed to be given to that particular person. Then the next measure is suppression of the convergence. If at all convergence has been instituted by that particular poison or that particular substance. Then fluid and electrolyte therapy, in case if the fluid and electrolyte imbalance has taken place, so you can correct it with the help of this fluid and electrolyte therapy. Next measure is termination of exposure, or it is also known as decontamination. So further exposure can be terminated, so that for any further damage can be avoided. Next measure is non-specific pharmacological antidotes are also available which can be given. Then elimination of the poison from the body. You can hasten the elimination. That is, either you can enhance the metabolism, or you can enhance the excretion of that particular substance which is causing poisoning. So because of that, it will be removed from the body at a faster rate. So again, it will be helpful to treat that particular condition. The next measure is hemodialysis or peritoneal dialysis can be done. So already if the poison is in your systemic circulation, so you can remove that with the help of these two processes. Now coming to the first measure by which you can control the particular toxicity, or you can treat the particular toxicity, is resuscitation and maintenance of the vital function. So whenever a particular patient is presented to you in whom poisoning has taken place, first of all, if it is a life threatening one, if there is some problem maybe with the breathing, the person is not breathing appropriately, or say the body fluids have decreased, temperature, there are temperature in changes, so all these vital functions of your body, the cardiac functions, all has to be monitored first and they have to be maintained. Resuscitation is a term wherein you if the person has gone unconscious, so you bring that person back to consciousness. Or if it may result in death, so you may take certain measures to get that patient, to save the life of that particular person. Okay, say artificial breathing is provided to that person. Okay, so to help reverse that particular condition which may be life threatening. Okay, so under this there are certain measures which are supposed to be taken. So let us see what are those vital functions which you should take care of. So first thing is, you should ensure patent airway. Patent in the sense airway, patent airway meaning open, they should not collapse. Your small bronchi or bronchioles, if they collapse, what will happen? Your breathing will get affected. Ultimately the oxygenation of that person also may get affected. So first thing is, you should ensure that there is patent airway, they do not collapse, or adequate ventilation is supposed to be maintained in that particular person. Okay, so breathing, appropriate breathing is supposed to be maintained. If there is hypoventilation, if there is a decrease in the ventilation, decrease in the breathing rate, obviously what will happen? The person may go hypoxic, less of oxygen will enter. Okay, then hyperventilation is also sometimes not good. Okay, because there may be mismatch in the ventilation and perfusion which may take place. Okay, so either ways the change in the ventilation is not good for the health of the particular person. So ventilation is supposed to be maintained in an appropriate range. Okay, the person should breathe appropriately. Okay, so ventilation maintenance is very important. If required, artificial ventilation may also be provided to that particular person. Okay, so artificial respiration may be provided, or 100% oxygen inhalation may be given as per the requirement of the patient. Okay, then the next measure is maintenance of the blood pressure. Your blood pressure to be maintained within normal value or normal range. Even the heart rate, if it is falling or if it is increasing, so you need to maintain the heart rate also to the normal level. Okay, now these changes in the BP and heart rate may also be affected by changes in the blood volume. Okay, so fluid changes in your body fluids will indirectly affect your vital function. So BP, in case if the blood volume is low, obviously the BP also will fall, heart rate also will fall. Okay, so that will show the deleterious effects on the body, right? If BP is not within normal range, if the heart rate is not normal, so these can be maintained within normal range by administering the fluids, or crystalloid infusion can be done, okay, to maintain the body fluids. In turn, it will start maintaining the blood pressure and the heart rate. So also drugs like pressure agents can be given. Pressure agents are the ones which increase the blood pressure, or the cardiac stimulants can be given, or the defibrillation can be done. That is, defibrillation is it is a technique wherein the ventricular fibrillation, it is a type of arrhythmia wherein the heart rate is disproportionately increased. So defibrillation is correction of your heart rate to normal. So such type of techniques can be tried to maintain the blood pressure and the heart rate at a normal level. The next, maintenance of the body temperature is also very important. Okay, in case if there is hyperthermia or hypothermia, should take measures to maintain the body temperature to normal level. Also monitor the blood sugar level. So if it is not normal, say if there is hypoglycemia, if there is decrease in the blood sugar level, you can correct it by dextrose infusion. So likewise, maintenance of all these vital functions is very important. It's a first step which you should take when poisoning has taken place. Then the second measure is identification of the poison. Okay. So to treat the poisoning, it's very important to know which substance exactly has caused the poisoning. So if you know what is the substance which has resulted in that poisoning, you can very well select certain antagonists. There are of course many of the substances for which selective antagonists are available. That is, antagonist is a substance which can reverse the action of a particular substance. Okay, they either block the action or they produce actions in the opposite direction. Okay, so likewise, if you know which is that substance which has caused the poisoning, you can very well give the selective antagonist, and you can antagonize all the actions of your poison. So automatically it will control all the symptoms. So there is a table which reflects few of the examples of substance which can cause poisoning and the antidotes and which mechanism that particular antidote is acting by. So first case is narcotic analgesics or opioid poisoning. Okay. So in this particular case, the best antidote or the antagonist is the naloxone, which is selected, and it is a receptor antagonist. It blocks all the receptors through which these morphine or pethidine produces their action. So by blocking the receptors, they can antagonize all the actions of morphine or pethidine or any narcotic analgesic. Then next example, iron salts. For this the antidote is desferrioxamine. Lead salts, penicillamine. Mercury salts, it is dimercaprol, and all of these three act by chelation. They chelate all this. Okay, this one desferrioxamine, it chelates the iron. Penicillamine, it chelates the lead, and dimercaprol, it can chelate the mercury. Okay, so this is the basic mechanism by which it will act as a antidote. Next example is anticholinesterases. Anticholinesterases, these are the drugs which inhibit the metabolism of ACH, acetylcholine. Examples of isostigmine, neostigmine, these are the best examples. So by inhibiting the metabolism, they will enhance the levels or they will potentiate the actions of acetylcholine. So in that case, the toxicity of acetylcholine or the poisoning due to acetylcholine increased levels may take place. So for this, the antidote, the selective antagonist is atropine. It is a ACH antagonist, that is, it is a receptor, muscarinic receptor antagonist, which will block all the actions of acetylcholine. Next example is organophosphorus anticholinesterases. So these are basically used as in the insecticides or pesticides. Okay, so such kind of examples for these antidote is pralidoxime. Now how it acts? It acts by cholinesterase reactivation. Okay, so these are anticholinesterases. So obviously they will inhibit the metabolism. So how this particular antidote is acting? By reactivation of the cholinesterase which has been inhibited by these particular organophosphorus compounds. So it is reactivated so that that enzyme will act and it will hydrolyze the acetylcholine. Okay. And the next measure is suppression of the convergence. In case if the poisoning has induced convergence. So in this particular case, maybe if the situation is not under control, you have to give the anticonvulsant drugs, like say for example diazepam can be given in an emergency by the IV route. This can be given. It's a very good anti-epileptic drug which can help in controlling the convulsions. Then the next measure is fluid and electrolyte therapy. Okay, so sometimes it may happen that fluids, your body fluids, there may be excessive loss of body fluids, there may be change in the body fluids. Okay, even the electrolyte imbalance also may take place. So these can be corrected by administration of certain fluids in the body to correct this particular situation. So the aim of this particular therapy is expansion of the circulating blood volume. It increases the blood volume. Also, it restores the venous return and cardiac output, which is low due to decrease in the fluids. So it will, by increasing the blood volume, automatically it will enhance the venous return, and also it will increase the cardiac output. Okay, because blood volume is directly proportional to these two particular parameters. Okay, so it helps in correcting the venous return and the cardiac output. Okay, so for this matter, isotonic saline is generally given, that is 0.9% NaCl, or isotonic glucose, that is 5% weight by volume of glucose solution may be given, or even plasma may also be administered for maintenance of the body fluids and electrolytes. Okay, now generally 1 liter of isotonic saline and 1 liter of isotonic glucose may be utilized per day in this particular situation, wherein the person in whom the fluid and electrolyte imbalance has taken place. Okay, to restore the fluid loss or to restore the electrolyte imbalance, these could be the measures which could be taken. Okay, sometimes electrolytes, the alkali treatment, or such kind of treatment to maintain the alkalinity, the pH of your blood may also be essential sometimes. So likewise, selection of an appropriate fluid is supposed to be done to be administered to that particular person. Even monitoring the urine volume is also very important. Urine volume and fluid balance is recorded to rule out any kind of renal failure. So if the poisoning has caused the renal failure, you will come to know from the urine output. So that is also an important parameter which you can focus on, and accordingly take the measures to avoid the renal function being precipitated in that particular person. Then the next measure is termination of the exposure or decontamination. Okay, so here, as the name implies, the further exposure to that particular poison is prevented. Okay, so you take that patient away from that exposure. Say for example, if the particular poison, it is an inhaled poison, if you inhale some poisonous gas, so what you can do, you can take that patient to the fresh air, so that the exposure is reduced, so that the person doesn't breathe that poisonous gas or vapors maybe. Okay, then next is washing the skin and the eyes. If the poison has entered through your skin or eyes, what you can do, you can wash that particular surface, or if it has entered your eye, you can wash the eye. Okay, so that will prevent further exposure to that particular toxicant. Then again, if the poison is an ingested one, if you have accidentally or maybe purposefully administered that particular poison by oral route, then what you can do, you can induce the emesis, or vomiting can be induced in that particular person by, say, syrup ipecac, or apomorphine can also be utilized. Okay, or household measures can also be utilized, like strong salt solution, mustard powder solution and all, or gastric lavage can be done, that is stomach wash can be done, that is the content of your stomach, these are removed by this is a specific technique or specialized technique wherein you introduce some washing fluid into the mouth with the help of intubations, and then remove that particular solution out, so that along with that solution, whatever contents are there or whatever poison which is present in your stomach, that also comes out. Okay, so that is known as a gastric lavage or a stomach wash. So these are the various techniques by which the exposure to that particular poison is further prevented. However, there are some precautions which you should consider while inducing emesis or vomiting. Okay. There are certain situations in which vomiting is not supposed to be induced. Okay. Obviously, vomiting will remove all the content from your stomach out. But supposing if the person is comatose, if the person is not in consciousness, or hemodynamically unstable person, in such individuals, if you induce the vomiting, it will worsen the condition. Okay, in case of comatose person, if the person is not in the consciousness, that particular content may go into the respiratory tract also. That can be quite dangerous. Then kerosene or corrosive poisoning, if at all has taken place, again there will be risk of aspiration in the lungs, and in case of kerosene or corrosive substance, if they enter into your lungs, they can be harmful to the lungs. Next is CNS stimulant poisoning. So in stimulant substances, if they have caused poisoning, then it can induce the convulsions if you try to induce vomiting in such patients. So it should not be tried. Okay. Again, if the patient is presented to you more than 2 hours after the ingestion of the poison, if already more than 2 hours have passed and the patient has come to you, so there is no point in inducing vomiting, because gastric emptying time itself is round about 2 hours. So already the poison has reached your intestine. So there is no point in inducing vomiting, because vomiting will remove the contents only of the stomach, not from the intestines. So it's of no use. Then if the poison or its dose which is consumed by that patient, if it is non-life threatening, you may not have to induce vomiting in this situation. Or if the patient has already vomited after consuming the poison, so in that case also vomiting induction will not be any help, okay, in this particular situation, because already the person has vomited out. So these are the situations in which the vomiting is not supposed to be induced. Okay. Now, apart from these, another measure is to prevent the exposure is administration of the activated charcoal. 10 to 30 grams of activated charcoal, it is suspended in 100 to 200 ml of water, and this is introduced in the stomach. Now what will happen is, activated charcoal, what is the property? It has an adsorbent property, right? So any drug which is there in your stomach, it will get adsorbed on the surface of the activated charcoal. Okay, so since it is adsorbed on the on the surface of the activated charcoal, the further absorption of your drug will be prevented. Apart from this, a universal antidote is available. Okay, that is the burnt toast in 2 parts, magnesium oxide, that is milk of magnesia, in 1 part, or tannic acid or strong tea, 1 part. So all of these are mixed together and they are administered orally to that particular person. So it will try to prevent the absorption of most of the types of substances. That's why it is called as universal antidote. However, one care which should be taken is that while administering the activated charcoal, there are certain substances which may not get adsorbed on the charcoal. Say for example, if the poisoning has taken place with strong acids or alkalis or metallic salts, or say iodine or cyanide, caustics, even alcohol or hydrocarbons or any other organic solvents, these are not getting adsorbed on the surface of the charcoal. So charcoal administration will not help in decontamination in these particular situations. If any one of these has caused poisoning, charcoal will not be of any help. Again, there are certain other precautions also. Charcoal is not supposed to be administered if there is paralytic ileus. If the ileum, the tone of the ileum is affected, okay, if it is loosened, the smooth muscles are relaxed in this particular situation. So in this situation, charcoal is not supposed to be administered. Or if there is intestinal obstruction, if there is any kind of obstruction to the movement of the contents of the intestine, so in that case charcoal is not supposed to be administered. Or if the patient has come to you after more than 1 hour of ingestion of the 2 hours of ingestion of the poison, because already the contents have moved to the intestines, so it won't be of any help. Okay, so this is how decontamination can be done. Then the next measure is non-specific pharmacological antidotes. Okay, say for example, as we have considered these points earlier also, suppression of the convergence. So if convergence has taken place, anticonvulsions can be given. If respiration is depressed, in that case actually the mechanical respirator facility is supposed to be utilized, or the artificial respiration is supposed to be provided. But till you get this particular support, you can go for analeptics. These are the drugs which cause the respiratory stimulation. So you can go for this analeptics, but this should be a temporary solution. Ultimately, you should have to provide the mechanical support to that particular person. Then next consideration is elimination of the poison. Okay, so if the poison has reached your systemic circulation, so you can hasten the removal of that particular poison from the body. Now, in most of the cases, in most of the substances which enter your systemic circulation, they are removed out of the body mainly through the urine. Okay, so what you can do is increase the urine output. Okay, and in certain cases, to remove the unabsorbed drug, even evacuation of the bowels may also be done. Okay, but this is the best measure to induce the forced diuresis, that is by administering a lot of fluids or by administering a diuretic. Diuretic is a drug which increases the urine output, right? It increases the loss of sodium and water from the body. So by administering such kind of drugs, you can increase the diuresis, you can increase the urine output. So that's why it is known as forced diuresis. You have induced it. Okay, so what will happen because of this? You will hasten the removal of your drug or that particular poison out of the body. Also, because of forced diuresis, your filtrate which is filtered in your Bowman's capsule, it will also be moved across all those tubules of your nephron at a faster rate. So there is less of reabsorption of the drug or that particular poison. Okay. Then another way by which you can hasten the elimination of the poison is by changing the ionization of that particular substance which has resulted in the toxicity. Okay, so now we have considered earlier in the movements across the biological membrane that any substance which is in the ionized state, that cannot cross a biological membrane, right? So in case of kidney tubules, reabsorption is very important. In the urine output also it is true. You all must have studied that more than 99% of whatever is filtered, okay, of the filtrate, it is reabsorbed. Okay, now along with that, the drug may also be, or that particular poison may also be reabsorbed. Now how you can reduce the reabsorption? You can increase the ionization of that particular substance. So if it is more in the ionized form, what will happen? It will be removed out through the urine. It will not get reabsorbed. Now for that matter, if you know what is the substance which is causing the poisoning, you can change the pH of the urine, because ionization of any substance is dependent upon the pH. Okay, so in the acidic pH, a weakly acidic substance, it remains more in the unionized form. So what you can do, if that particular substance is acidic in nature, you can alkalinize the urine. You can increase the pH of the urine by administration of sodium bicarbonate. So what will happen? pH of the urine will be alkaline in nature. So any acidic substance, it will be more in the ionized state. So phenobarbital or salicylates or propanacid, it will be more in the ionized form and it will get excreted out. Whereas you can reduce the pH of the urine towards the acidic range in case if your drug or that particular poison, it is basic in nature. Like say for example amphetamines, pethidine, chloroquine. So what will happen? When this basic substance, it encounters an acidic pH, it will remain more in the ionized form and it will get excreted out through the urine. So changing the pH of the urine also may hasten the elimination of your drug or the poison. Then next measure is hemodialysis or peritoneal dialysis. Okay, so these particular techniques are specialized techniques which require some specialized equipments for carrying out these particular processes. So dialysis, generally it is the process of removal of the toxic substances from the body in case of kidney failure. Okay, in certain individuals wherein the kidneys do not work properly. So if they don't work properly, what will happen? The toxic substances which are generated, they won't be removed out of the body, right? So in that case, dialysis is done. Okay, so the toxic substances are removed out. Peritoneal or hemodialysis. Hemodialysis meaning dialysis of the blood. Okay, peritoneal dialysis. The peritoneal fluid is removed out of the body. It is passed through certain substances which will absorb all the poisonous substance or toxic substance, and then fluids are returned back to the body. So here in this case, the blood is dialyzed. Okay, so these are the specialized techniques which are even more effective than the forced diuresis, which is induced to remove the drug out of the body, which is there in your systemic circulation. Okay, now generally, which are the situations in which the dialysis is supposed to be instituted? The situations like in case if the patient's condition is deteriorating, in spite of your conventional treatment, if the person's condition is deteriorating, you should go for dialysis. That means that poison, it is there in your systemic circulation in more amount and it is causing the deleterious effect. Okay, or oliguria or anuria. Oliguria is reduction in the urine output. Anuria is total absence of the urine output. So urine output, if it is totally stopped, then obviously your poison will not be removed out, right? So in that case you should go for dialysis. Or if there is a presence of very high blood levels of these particular substances which may cause poisoning. Okay, here some examples of drugs are quoted, aspirin and phenobarbital. So if very high amount of that poison has entered your blood, you should better go for the dialysis. Okay, now out of these two processes, hemodialysis is actually more effective as compared to the peritoneal dialysis, but peritoneal dialysis technique is a little bit easier and it is safer as compared to the hemodialysis. Okay, but hemodialysis, it requires critical instruments and it can be done only in the special centers. Okay, usually peritoneal dialysis may be preferred, and in severe cases you should go for the hemodialysis. Okay, so the examples of some drugs are quoted over here, which can be removed by the process of dialysis, that is amphetamines, barbiturates, phenytoin. Okay, then diphenhydramine, methaqualone, MAO inhibitors, propoxyphene, then TCS, that is tricyclic antidepressants. Okay. So this finishes the management of poisoning. Thank you.